Mouth mirror and compressed air process evaluation. The student demonstrated use of the mouth mirror to an instructor by performing the following. Used mouth mirror with both dominant and non-dominant hand. Held the mirror handle with pads of index finger and thumb. Held the mirror with thumb and index finger directly opposite each other. The mirror handle is obviously visible between them. Keep the pad of the middle finger on the instrument shank. Rest the handle between the second and third knuckle of the index finger and maintain a light grasp with no fingers blanched. Use the mouth mirror with proper finger rest. You will be graded upon the instructor observing each sextant of mirror skill noted below. Ring finger touched middle finger. Ring finger was straight. Little finger was held close to ring finger in relaxed manner. Stabilized the ring finger and demonstrated that in intra and extraoral fulcrums. Inserted the mouth mirror intraorally. Inserted the mirror face parallel to the occlusal plane. Rotated the mirror to vertical position after clearing occlusal surface. Prevented mirror from clanking on teeth. And defogged the mirror by rubbing on buccal mucosa or applying mirror defogger with gauze. Used in all areas of the mouth with proper grasp and fulcrum. Please demonstrate use of indirect vision on the lingual of tooth number 8.
I would have to say on tooth number 8, on lingual surface, if it was a distal lingual surface, that would be a near surface for me. And so I would be in my 8 o'clock position if I was a right-hand operator, and it would be a far surface for a left-hand operator, I'd be at noon. Me, I'm at 8. My patient's chin is up, a little higher, and straight in the center. I would use my equipment. My light would be at a 45-degree angle to see the maxillary, and my tray table would be close. My non-dominant hand would hold my mirror with a soft C shape, middle finger touching index finger and ring finger touching middle and supported, and my ring finger, pinky fingers relaxed. I would retract by not clanking the teeth, and indirectly I would have a fulcrum on either outside of Christina's mouth to see number 8 distal lingual, or I could use an intraoral fulcrum on tooth number 6 to see number 8. So I can see number 8, my posture still is maintaining a neutral body position, and then I would take my dominant hand, a C shape. I would work on tooth number 9, and then I would point to the surface on tooth number 8, lingual, demonstrating indirect vision on 8, and also having my grasp, maintain my grasp, maintain my posture, maintain my neutral wrists, and being able to look at that area.
Next, demonstrated indirect illumination on the lingual of tooth number 12.
And to see indirect illumination, if it was 12 lingual is my near surface again. So I would remain at 8 o'clock, 9 o'clock position. If I was a left-handed operator, number 12 lingual would be a far surface, and I would have to be at position number 1. I would again use my patient's chin to be up, and if it's 12 lingual, my patient's chin is away from me, and maybe slightly higher up, just a little bit. My equipment, my light is at 45-degree angle, and to see indirect illumination, I'm actually trying to capture the light like a flashlight, and I'll have to cock my mirror to kind of show the brightness reflecting into the mirror on 12 lingual. So what I first want to do is have my bracket table again close by. My non-dominant hand is going to hold my mirror with a C shape, middle finger and ring finger all supported. I'm going to, again, go inside the mouth, not clanking the teeth, horizontally, turn the mirror to look at number 12, And I would show the teacher how the light gets brighter if I cock the mirror, showing it onto 12 lingual, probably fulcruming on tooth number 7 to see tooth number 12 lingual. Again, my wrist is neutral. My dominant hand holds my instrument again with a C shape. Ring fingers extended. It flies in and lands on tooth number 13 to do number 12. Then I would point to number 12 lingual, make sure my posture still stays good, and I could do some type of an activation stroke, whether I could demonstrate a rock or a pivot, just to pretend that I'm really working on that surface. Okay?
Use the mirror to retract first the cheek on tooth number 3, facial.
Okay. If I was doing 3 facial, that's a near surface, so I have the patient's chin. Myself, I'd be at 8 o'clock or 9. A lefty would be at patient position, a far surface would be at 1. My patient's chin is up and slightly away from me. I would again retract to see number 3, and possibly I would have to use it to retract and indirectly see, so I would take the mirror in and turn it. And to see 3 distal, I have the patient slightly close a little bit so it's more relaxed. You don't want to have the mirror hurt the patient's corner commissures of the mouth or the lip embrasure area. So what I want to do is make sure I retract and then use my mirror to indirectly see the distal lingual of 3, distal facial, I'm sorry, of 3. Maintain my C shape. Maintain the fulcrum. My light is 45-degree angle, so I can brightly see and maybe have to tweak it a little more. Then I want to make sure I can see it. My dominant hand would again use my C shape, middle finger and ring finger. If I was doing 3 facial, I would land on number 4, the occlusal lingual cusp, point to the distal surface on the facial side, and again I could show a rock or a pivot or a roll. But I want to make sure I'm maintaining my C shapes in both hands and my fingers are together.
Retracted with the mirror by retracting the tongue. Operator will look at tooth number 20 on the lingual.
Okay. Tooth number 20 is a far surface for a right-handed operator and a near surface for a left-hand operator. So for a right-hand operator, I would say that's my far surface for tooth number 28 lingual.
28 lingual.
And I would also turn myself to the 11 o'clock position if it was a far surface. For lefties, it'd be a 3 or 4 o'clock position. My patient's chin would be down and toward me, and maybe down just a little more, perfect. And then I would take my light, my equipment, it would be at a mandibular light position. Bracket table is close. My non-dominant hand holds it with a C shape. I need to land a fulcrum. To do 28 lingual, I would land on 12 or 13. To protect the tongue, retract the tongue, and indirectly see 28, I would hold the mirror down. If it got foggy as I was looking at it, I would wipe it off with a buccal mucosa like it did. Maybe have the patient breathe out of their nose would be a nice tip to say. Hold the tongue down. Make sure I'm landing my fulcrum. Take my dominant hand. Again, C shape, middle finger, ring finger. To do 28 lingual, I would land on 27, incisal edge, and then I would actually show the instrument either rock, pivot, or roll, and I could touch 28 distal lingual to show the teacher that I can see 28 and my instrument's on the surface, so I'm actually able to really use this without breaching my posture.
Demonstrated use of the mirror for protection.
And on 28 lingual, I did that for protection and retraction at the same time. So I won't re-demonstrate that one because you'd actually hold the tongue down and be able to retract and protect the tongue so it doesn't get injured.
And the last one is transillumination Transillumination will be demonstrated by the operator on tooth number 24.
To do tooth number 24, I still would be for transillumination always at noon position if you're a left-handed or right-handed operator. My patient's chin would be down and straight in the center. To do 24 and 25, my equipment wouldn't be in the typical mandibular light position overhead. It would have to be directly through the beam of the tooth at a perpendicular or 90-degree angle. So my light would have to be adjusted more at a 45-degree angle for the mandibular teeth. I would take my mirror, use a C shape, middle finger and ring finger. I would land on tooth number 20 or 21 occlusal. I would look through the enamel and make sure I didn't see any incipient lesions or any carious lesions. And in this case, Christina's enamel looks good.
Precautions used by the operator during this portion of the evaluation includes ensuring patient comfort by not hitting teeth or resting mirror rim against soft tissue. Did not use pressure on corner of mouth. Part 3. The student will demonstrate use of compressed air to an instructor. In the dominant hand, use a palm grasp. Tested the airflow and cleared water from the line outside of the patient's mouth. Informed the patient of the intended procedure.
Christina, I'm going to be using air right now. Are your teeth sensitive anywhere to cold things?
Up here a little bit.
Okay, I'm going to try to avoid that area then.
Okay.
I'll use cotton for that area to dry it. And I'm going to be spraying a little air, a little gentle puff of air.
Okay.
Aim syringe tip toward area of operation. And used short, gentle applications of air. Air puffs, not blasts. Thoroughly dry teeth and gingiva to increase visibility. Deflected gingival margin slightly for calculus detection.
The tissue's kind of puffing away from the tooth, and I could see if there's any subcalculus on a tooth that way, subgingival calculus. And I don't suspect or see any. I could also use my mirror to see if there's any calculus. So again, I'm going to look for indirect vision, my mirror use, look lingually on the lower anterior teeth, and spray some air to check for any visible calculus. Now when you spray on the air use, you might have to clear your mirror if it gets foggy. And when you're spraying in a lower anterior, you're looking for any white chalkiness. That would be supracalculus or supragingival calculus. And in this case, I see a little bit of calculus in between, slightly at the contacts, but very slight. And so the teacher would probably want you to demonstrate what you actually see with the air use.